You can go there. Yes. I am just here to support her. And Garima, you have an Instagram channel.
I have Instagram and YouTube
channel. YouTube.
Jeet
ko kudos the camera.
Yes, Sujit, this is because of you.
So, Garima and
Siddharth.
Chalo, Siddharth to I a very good friend. सबका ही कोई अच्छा friend Siddharth. There are 4 Abhishek nephrologists in India.
Very next and on the Abhishek.
Good. Thank you. That's nice meeting you. That was all. That was. Eat coffee now.
Born here.
Okay, born.
No, not exactly in this house.
But Patna.
But. My ancestral place is in Bhagalpur.
भागलपुर. हाँ. I
But
don't know, somehow मम्मी को पता था कि आपका.
अच्छा भागलपुर से. Maybe I must have told her.
हाँ, maybe.
Mummy has a very sharp.
हाँ.
वो बैठ के सुनती रहती है कहानी.
Pets are a very big, like they are very big stress busters.
Yeah.
They are just like kids.
Yeah.
We were living in Delhi ना.
अच्छा.
We just got कुछ फर्नीचर हम लोग वहीं से ले आए ना. ये हमने वहाँ पे गुड़गांव में खरीद लिया था.
हाँ.
बंजारा मार्केट से.
Correct.
The good thing about Medanta is that they have this set sort of infrastructure that they build everywhere. And see, dialysis is not a very rewarding business. The RO plant that we have in Medanta, it's not there anywhere else in Patna. Initially, it was like MBBS. When you go there in the first year, you immediately regret your decision. Apart from their doctory knowledge, I don't think they have any knowledge about anything else. I started understanding that if I can't take a drug, how can I expect my patient to take a drug for so long?
Do doctors also Google symptoms or it's?
Sir, मैं तो परहेज कर रहा हूँ. मेरा creatine कैसे बढ़ गया? Pig kidney का size is very similar to human kidney size. I don't believe in like adding, like replacing, supplementing your meal with a protein powder. Even doctors sometimes get confused between a nephrologist and a urologist.
रोना आप अफोर्ड नहीं कर सकते हो when somebody in your family is going through something like this. Thank you so much, doctor, for joining me today on the Story Bar podcast. और आज बिना फीस देके देखने के लिए thank you so much for that.
Thank you, Garima.
Doctor, first I would love to know कि किस पॉइंट पे आपको लगा कि डॉक्टर बनना है और एंड व्हाई नेफ्रोलॉजी?
मेरे घर में मेरे दादाजी was a doctor, my mother is a doctor, and I was in this surrounding. I mean the society was full of doctors. तभी मुझे डॉक्टर नहीं बनना था. So I wanted to be a journalist. So
wow.
we used to get this magazine called The Week magazine. So, and I was at a very impressionable age. I was around 7th class or something. And that's when the Kargil war was fought, 1999. Na? So there was this big article and Barkha Dutt was there. I was so inspired by Barkha Dutt. I was like, I have to become a journalist.
Wow.
But my mom obviously talked me out of it. She's like, don't be stupid, journalists don't earn money.
But आज आप क्या सोचते हैं इसके बारे में?
So once I became once I started MBBS, I started finding, I was like, okay, this is the only thing that can actually get me going in the morning. I was a very lazy person. So I was like, the idea of going and working and people would suffer if you don't go and work is the only thing that motivated me to get out of bed. So I was like, this is perfect for me. And initially it was like MBBS, when you go there in the first year, you immediately regret your decision. You're like, oh my God, what am I doing? And it's a totally different thing that is taught. It has not been taught before and you're not ready for it, is what I felt. I mean, there must be people who were much more inspired and who were much more aware. So this was my initial thought about doing MBBS. It was stressful the first year especially. Like there were things that you have to cram up, and it was getting impossible, and the words were very difficult to make out. There was literally a dictionary that we had, which is there's a medical dictionary. People still might be having it. So, but so yeah. So in the beginning it was difficult. First 6 months and all were difficult. So some things you find interesting in MBBS when you join first. You have 3 subjects. One is anatomy, which is a lot of cramming. The other is physiology, which is interesting, which you enjoy. And the third is biochemistry. So if you like chemistry, you might like bio. It's a little bit different. You still have to mug up. But from second year onwards, when you start learning about diseases and how diseases start occurring and what the normal thing was and how it changes, and that's when you start finding medicine actually interesting. So basically, the second year onwards, I felt more comfortable and I felt like, हाँ ठीक है ये तो कर सकते हैं. I'll be very frank. My aim was not to stay back in India. I was like, I'll write. There's this exam called USMLE. I'll write the MLEs and I'll push off to the US. I had a lot of relatives there working. Like you get good pay over there,
Right.
So and there's not too much tension. No, so and it was not that difficult. Indian PGs are considered, I think, more difficult. But what happened was I got very good friends in MBBS, and since everybody else was preparing for PG, I also decided to prepare for PG.
And do you think like doctors are the most intelligent people?
Absolutely not. They're the most. Apart from their doctory knowledge, I don't think they have any knowledge about anything else. So it sort of engulfs you. So your other hobbies that you have, slowly they die out. I have somewhat like managed to keep a few hobbies, but otherwise that's what happens. So the last thing being nephrology. Why nephrology? I was not sure about nephrology. So I had an aunt, my mother's younger sister, who was a kidney patient. She underwent a transplant in 2009, and unfortunately, because of some complications, she passed away in 2015 because of some infections. So that is what inspired me. Either I take nephrology, or my father was a gastro patient, so I'll take gastroenterology. So when I wrote my the DNB exam, I was like, if I get nephrology or gastroenterology in Gangaram, I'll take it. So that's how. Yeah. So I just got it, and I was like, okay, fine, I'll take it.
And how aware do you think people are about chronic kidney disease?
So the awareness is definitely low amongst people, and about not only chronic kidney disease, about any disease.
Yeah,
So,
that's there.
So we as humans don't want to feel sick. No, nobody wants to feel sick. Nobody wants to take a pill. Nobody, not even us.
Yeah.
So we, no, I mean, I had to start taking a pill for like 2 months every day, and I could not do it. When we write, nephrologists have the biggest prescriptions. I mean, there are studies done that nephrologists write the maximum number of drugs. So for me, I started understanding that if I can't take a drug, how can I expect my patient to take a drug for so long? But you have to. I mean, sometimes there is no other way out. Idea of not being dependent on drugs is what everybody wants to feel healthy.
Yeah.
Nah. So they sort of, sometimes I feel they ignore their health conditions. So the most common cause of kidney disease right now and for the foreseeable future is diabetes. But I have seen so many patients. I mean, the maximum number of patients that I do get in my OPD are patients who have had uncontrolled diabetes not for 1 year, not for 2 years, for like 10 years, 15
But
years.
it has got undiagnosed throughout.
Not undiagnosed. They have been
have
diagnosed,
okay.
but they have chosen some other remedy, or they have ignored their condition. Just because you feel healthy at one point of time doesn't mean that you're healthy. So, so diabetes being the epidemic that it is, if you don't try to control it through lifestyle is definitely one way of controlling it, but you have to take the help of drugs. If you're not serious about it, it is going to affect not only your kidneys, it's going to affect your whole body. And the maximum number of patients who have a heart attack or who have a stroke are also diabetics. So we have to be aware of these basic things first, and then obviously you have to know the consequences if you're not. So that has to percolate into the society. I feel the urban population is getting more aware now, but there is obviously a large chunk of our population is rural. So amongst the rural crowd, it's not. I mean, the information has not been delivered to that crowd effectively as of now. But I'm pretty sure with the advent of internet and all these things, people are getting more aware, and I think that would help in the future.
कितनी बार ऐसा हुआ है डॉक्टर कि आपके पास कोई पेशेंट आया है एंड व्हाट यू हैव सीन इन दैट पेशेंट इज दैट कि वो स्टेज 4 या स्टेज 5 CKD पे है? कितनी बार ऐसा होता है कि creatinine has crossed like 5, 6, 7 because I think the healthy number is 1, less than 1, right? तो कितनी बार ऐसा होता है कि लोगों को पता ही नहीं है कि उनको ये प्रॉब्लम है?
ऐसा होता है in a good chunk of people. So the maximum number that, like, people who just become aware of the condition, they come to the emergency with some breathlessness or some sort of thing, swelling, breathlessness, usually इस complaints के साथ आते हैं, and or very high BP, and when we check them, we find that their creatinine is already 8 or 9. This happens more with the younger population. Ki they are unaware of the condition, and there is nothing that you can. Sometimes there's nothing you can do about it because the signs and symptoms of kidney disease are very subtle. Now, sometimes even taken for granted. Like, अच्छा हम बहुत ज़्यादा देर बैठ गए तो मेरे पैर में थोड़ा सूजन हो गया. No, that's not normal for somebody who's 30-year-old. No. So we have to, if somebody is aware, sometimes if the person approaches a doctor or any medical health professional at the right time, and if the medical health professional gives them the right kind of advice, you can actually at least stall the progression of those kind of kidney diseases because they are usually related to some pathology of the kidneys. Sometimes your own immune system is acting against the kidneys and destroying it slowly. Not slowly, but like in a span of 2-3 months. So, but there is a very short window. Once you lose that window, then it becomes difficult to actually salvage the kidney.
बट डॉक्टर थोड़ा सा ये डिफिकल्ट टू कॉम्प्रिहेंड अभी हो रहा है. यू से दैट यंगर पॉपुलेशन में ये ज़्यादा प्रॉब्लम.
This kind of a scenario कि आप you are fine, because the younger population can tolerate more stress now, and the older population who gets kidney disease usually has some preceding disease like which has led like BP or diabetes. So they are already in touch with a medical health professional. Younger population में ऐसा होता है. So the major chunk of these kind of patients are a little bit younger. Sometimes it also happens with the rural, if they have not gotten a medical health checkup done ever. You can get such kind of patients कि हम अभी तक तो सब कुछ ठीक था. So if you're talking about percentages, let's see, like in the last 2 days in the OPD, I would say there were at least out of 15 patients, 3 who figured out that their creatinine is high. They visited a healthcare professional, sometimes even an orthopedician because they were having leg pain, or sometimes a general physician because of the pedal edema, and they asked them to go and visit a nephrologist. So this has happened, but usually these people who come to the OPD have a creatinine of 2-3. They're not immediately dialysis dependent, and some of them might have a disease. So our job is to look for something that we can reverse. There are very few things that we can do to reverse kidney disease. If if there are very few diseases that you can reverse, but those diseases, if we catch them early, we can keep the patient dialysis free for a very long time.
Wow. My only thing is कि हम लोगों को सर दर्द भी होता है ना, we Google
Exactly, हाँ.
क्यों हो रहा है, क्या हो रहा है, तो ये थोड़ा सा कंफ्यूजिंग इसलिए लग रहा है कि बिकॉज स्पेशली द यंगर जनरेशन चैट जीपीटी से तुरंत पूछने लगता है, आज पेट में दर्द हो रहा था, आज सर पे दर्द हो रहा था, तो क्यों हो रहा था, एंड इमीडिएटली वी आर लाइक हाइपर अवेयर कि ये भी हो सकता है, ये भी हो सकता है, ये भी हो सकता है. डू डॉक्टर्स ऑल्सो गूगल सिम्टम्स और इट्स it's like
so we have our own apps which we use.
Your own AI engine.
Yes, we have our own apps and things that we use which can help us in like point of care decision making. Like if we are there, we want to know ki, acha, what else to do, so we have some apps are there which we use.
You won't disclose the names.
No, there's an app, it's well known app, up to date karke hai. There's an up to date.
Okay.
Up to date is used everywhere.
Okay.
It has a 20,000 rupee per year subscription.
Oh wow. For the right reasons.
Yes. So it has its own 20,000. So we use that. I use it. I mean, not everybody uses. I use it very often, and I find it very useful because we don't find time to read otherwise.
Right.
So you can just read on the go and refresh your memories because nobody remembers everything. And so it helps you in with the differential diagnosis and all that. As far as like googling symptoms, see, sometimes it's so to come to a particular diagnosis, you can't only rely on the symptoms. You can't only rely on the history, and you can't only rely on the investigations. You have to have a summation of the three. ChatGPT is getting better at it. No, so yes, I know a couple of friends who have used ChatGPT with putting all these informations in one together can actually get you good results with ChatGPT. So it's not about, so like if a lay person is just googling their symptoms, a headache can have a million probabilities. So, but you should know what to Google. Everybody is googling.
Yeah.
But you should know what to Google. Yes.
Yeah. And daily basis पे डॉक्टर हम लोग knowingly, unknowingly, mostly क्या ऐसा कर रहे हैं जो कहीं ना कहीं हमारे किडनीज को डैमेज कर रहा है?
Very good question. Because आजकल we have figured that I mean people have been doing research, and so there's this disease, chronic kidney disease of unknown origin. So it's called CKDU, right? तो CKDU में देखा गया कि there was in China they did a research where the Chinese herbs that people were using were actually were producing a kidney toxic substance and leading to kidney disease in like many people in a particular area. What they saw was that everybody in that area was getting kidney disease. So they came down to this thing. This happened not only in China, this has happened in India also. In a village in Andhra where the lot of farm workers were found to have kidney disease because of, I think it is excessive sweating because of the environment, and they were taking a lot of sugarcane juice which was high osmolality. So that was leading to kidney disease in young people. Another example has been the use of beauty creams. So there is a particular cream. So we had gone to a seminar recently, just I think a month back, where they had done a study in which patients were getting a kind of protein leaking disease. It's called nephrotic syndrome, because of a cream that is easily available even now on Amazon for everyone to buy. I'm not going to reveal the name, but so yeah, even the beauty creams, skin whitening creams where you so there's I don't know if you Google Balkan nephropathy, So there's a particular substance called aristolochic acid. I'm not getting the pronunciation wrong. So that was also causing kidney disease. So sometimes toxic substances, uh, heavy metals in our food, um can lead to kidney damage. There's so many things that can cause that can affect your kidneys, and so many of them that we don't even know about. So we have to be aware of the heavy metals that might be there in.
Any product that we're using, like on a
Yes,
skin,
yes,
even on a
even
skin.
on your skin. Yes. So skin products. Uh, so the most common thing that we blame, sometimes we do blame ayurvedic medicines because we don't know exactly what herbs are there in it, and we've already seen that Chinese herbs have caused kidney disease. So we also we are against, we advocate against using ayurvedic drugs, and that's the reason why.
अब मम्मी को बता सकते हैं ये जाके बिकॉज ये भी बहुत बार होता है. लॉट ऑफ पीपल, यू नो, आप नॉर्मल कॉन्वर्सेशन कर रहे हो, बता रहे हो कि हाँ हमारे घर में पेशेंट है, तो दिल से कि यहाँ जाओ, वहाँ पे एक शिविर लगा है, 6 महीने तक वहाँ रहो, पूरा आयुर्वेदिक सब कुछ चलेगा. सो एट इनिशियल थॉट इज कि कैसे भी ठीक करना है, बट then of course you have to consult the main doctor, which is allopathic doctor, and that person always advises against it.
कि ये any nephrologist would advise you against.
Like so far in the last 10-12 years we have not come across any person who has said कि हाँ alternatively आप ये try कर सकते हो. तो ये reason है. तो फिर I think what about diet को अभी क्या हो रहा है? We all want to like sugar का intake जितना कम कर सकते हैं कर रहे हैं, कोल्ड ड्रिंक यू नो नहीं लेना है, कभी कभी क्रेविंग होता है तो वी पिक अप अ कैन ऑफ डाइट कोक एंड इट्स कूल, लाइक वैसे फील होता है कि हाँ वो टेस्ट भी मिल गया और पीछे इंग्रेडिएंट्स में पढ़ रहा है कि हाँ नो एडेड शुगर, जीरो एडेड शुगर. द मार्केटिंग इज सच दैट यू फील दैट देयर इज नो शुगर गेटिंग इनटू योर बॉडी, बट फ्रॉम द किडनी पॉइंट ऑफ व्यू व्हाट इज इट?
So yeah, obviously I think anything from the cold drinks, I haven't come across anything that is blaming the sodas for having for having kidney disease. But what happens is that these things have a particular osmolarity, if you know. No, so there have been studies where very high osmolarity product. Osmolarity is कि कितना सल्यूट है उसमें. ना मतलब ह्यूमंस का ऑस्मोलैरिटी जो होता है दैट इज अराउंड 300 ना. तो हम अगर कुछ वैसा पीते हैं जिसका ऑस्मोलैरिटी ज़्यादा होता है, वो दैट डिहाइड्रेट्स, यूजुअली टेक्स आउट सोल्यूट्स जो होते हैं किडनी को निकालने होते हैं. सो यू आर एडिंग मोर प्रेशर टू द किडनी, हाँ, ऑन योर किडनीज.
एंड व्हाट अबाउट नॉन-वेज फूड?
एनीवन हु हैज नॉर्मल किडनी फंक्शन, if they eat non-veg food, it shouldn't be a problem.
Like if you're having chicken 3 times a day, every single day, is it okay? Or and I'm just talking about chicken right now.
Yeah.
Mutton, जो हमने गूगल करके जो भी पढ़ा है कि it takes longer to digest.
So the problem with mutton is कि mutton has more acidic proteins. Red meat has more acidic proteins. So anyone with a kidney disease, if they take red meat, the amount of acid in their body increases, and the kidney is supposed to take out the acid. Now, so that's why we recommend कि भाई mutton तो मत ही लो. Now, as far as like chicken 3 times a day goes, anyone with normal kidney function and no hypertension, if they are having a moderate amount of proteins, even though it's animal, we prefer plant proteins.
Okay.
ना plant proteins अगर हम लें, that is better for the kidneys. Animal proteins, if they're taking up to 1.2 grams, some people are going to the gym, and if they're actually working out that way and they're taking proteins, should not be too much of a problem. But if they have any issue related to kidney, even if they are not aware of it, that is going to sort of accelerate the process, because if there is leakage of protein from your kidneys, those proteins are toxic to the cells of the kidney. So excess protein is not good, because it's going to go through your kidneys and it's going to damage the kidneys. you need protein for to maintain a good to maintain good health, because your body needs protein.
Right.
So what the guidelines everywhere recommend is to take a moderate amount. To some nephrologists even recommend a low amount of protein. So zero point 0.6 to 0.8 grams per kg of lean body mass is like your normal weight, is considered appropriate for kidney disease. If person has kidney problem, normal person should take 1 gram per kg.
Okay, yeah.
If you are doing something, some heavy
Yeah.
working, you can take up to 1.3, 1.4. So that does not affect your kidneys. But if you have a kidney problem, then you should not take it.
सो जो नॉर्मल इंडियन थाली है डॉक्टर, उसमें अगर आप चेंजेस सजेस्ट करना चाहेंगे, बिकॉज दिस इज समथिंग वी आर सो यूज्ड टू ईटिंग कि हमें पता भी नहीं चलता कि उसके साथ कुछ प्रॉब्लम हो भी सकता है.
हाँ, कॉमन मिसकंसेप्शन जो मैं देखता हूँ इन आवर सोसाइटी अबाउट किडनी डाइट is कि you just take out all the proteins. If somebody gets a kidney disease, बोलते हैं कि सर मैं तो परहेज कर रहा हूँ, मेरा क्रिएटिन कैसे बढ़ गया ना. The kidney disease का progression does not depend on whether you take dal or not. If you're not taking dal, you're getting more and more malnourished.
Yeah.
ना. So there is a reason why people eat dal with चावल ना, because हमारे बॉडी में कुछ essential amino acids हैं जो बॉडी बनाती नहीं है. तो दाल में कुछ होते हैं और चावल में कुछ होते हैं, या फिर रोटी में कुछ होते हैं. तो दाल तो हमें लेना ही है. मतलब ऐसा नहीं है कि आप दाल से परहेज करने लग जाओ, या बिल्कुल ही मतलब कि पता नहीं कद्दू खाने लग जाओ सिर्फ ना, सिर्फ कद्दू खा रहे हैं, या सिर्फ आप क्या कहते हैं लौकी खा रहे हैं, सिर्फ हरी सब्जियां खा रहे हैं. ऐसा नहीं, दाल आप ले सकते हो. वही तो मैंने, इसलिए मैं बोला कि 0.8 ग्राम पर केजी पर डे प्रोटीन इनटेक इंडियंस का है ही नहीं हमारे डाइट में. हाँ, हम तो खाते ही नहीं है. हम तो एक अंडा का उजला वाला भी खा लें. एक अंडा का उजला वाला, यूजली 1 होल एग हैज 6 ग्राम्स ऑफ प्रोटीन, नॉर्मल साइज्ड एग. तो उसमें से 2 ग्राम जो होता है वो उजले वाले में होता है, 4 ग्राम जो होता है येलो वाले में होता है. तो यू कैन टेक इफ यू टेक अ एग वाइट, तो सिर्फ 2 ग्राम प्रोटीन खा रहे हो आप ना. तो उसमें यू शुड नॉट, आई मीन यू कैन टेक 1 एग वाइट ऑन अ डेली बेसिस आल्सो, इट शुड नॉट बी अ प्रॉब्लम. द अदर थिंग दैट depending on the stage of the disease, we have different sort of diets. So अगर किसी को किडनी की प्रॉब्लम है which is a very advanced stage, कि patient might be going into dialysis in the near future, 2 things that we need to keep low in the diet, that is, one thing is phosphorus, the other thing is potassium. ना. So phosphorus usually आपके nuts में होता है, आपके milk products में होता है, आपके आपको कि मिल्क प्रोडक्ट्स मेन होते हैं, नट्स में होता है, किसी आई थिंक वेजिटेबल्स में भी साग में होता है. साग में फॉस्फोरस पोटेशियम ज़्यादा होता है. हाँ, तो वो फॉस्फोरस हम थोड़ा बोलते हैं मिल्क प्रोडक्ट्स अवॉइड कर लो थोड़ा ना. वॉट एवर यू टेकिंग, डोंट स्टॉप टेकिंग इट, बिकॉज इट भी खाना तो सबको खाना होता है. यू इफ यू डोंट ईट, यू नॉट गोइंग टू गेट नरिश्ड. सो वी डोंट वांट टू, it sort of disheartens the patient कि आपने सब कुछ ही मना कर दिया ना, तो क्या खाओ, बिल्कुल चुन के खाओ वैसे. And you, I think the doctor should also try to think whether the doctor will be able to maintain that kind of a lifestyle.
Yeah.
तो वो तो it's difficult, so you should not like totally cut off everything, but जैसे if you're taking milk products, पनीर ले रहे हो आप, या फिर आप छेना खा रहे हो, या फिर आप दही ले रहे हो, just cut down on it. Don't totally get rid of it, or you fix your days कि भाई इस दिन हम खा लेंगे. जहाँ तक पोटेशियम की बात है, we are really scared about potassium. So potassium is there in almost all fruits. In some fruits it is in a higher amount than the others. So normally हमारा जो in a go what we mention is that you take apple, papaya, or you take pineapple, or you take guava also. I think has a little bit of high potassium, but you can take guava also without the beej. Now beej usually has the potassium, so you can take these, and except all that you avoid थोड़ा blanket करके. But if you want to really delve into what kind of, if you want to make healthy food, there are some other fruits also which have a low amount of potassium, which you can take. Normally we consider somewhere around 200-250 milligrams of potassium per 100 grams serving as a low potassium.
Okay.
And so some fruits have a very high potassium, so we recommend against it. And this is palak saag ho gaya, we recommend it because. And the other thing is कि if you are using vegetables, you leach the vegetable. Leaching is like you either फुला के रखना है उसको ना, 3-4 घंटे फुला लो, या फिर आप उसको आधा घंटा आप 15-20 मिनट उबाल लो एंड पानी को ये कर दो तो पोटेशियम थोड़ा निकल जाता है, तो फिर आप उसको यूज कर सकते हो. अदर थिंग्स, नट्स अवॉइड करने, और सेंधा नमक भी आप अवॉइड कर सकते हैं. सेंधा नमक हैज अ वेरी लिटिल बिट ऑफ पोटेशियम क्लोराइड. सेंधा नमक, लोना सॉल्ट, these kind of salts have potassium in them. That's why for healthy people it is good for you because क्योंकि सोडियम कम ले रहे हो आप. सोडियम promotes hypertension.
Right.
But in a CKD patient it's different. You want to avoid potassium, so you should avoid सेंधा नमक, लोना salt, ये जो pink salt और ये सब होती है avoid करने चाहिए.
And is fasting okay for CKD patients?
No, I would not recommend these. Like our fastings are very rigorous.
Yeah.
हाँ. से हमारे कल्चर में, से बिहार में तो the kind of fasting that is done, it should not be done for CKD patients because it can lead to multiple things. Gastritis हमारा सबसे common problem होने लग जाता है. We have to take medication, so should avoid fasting. And it's better because the symptoms, most common symptoms that we see in our clinics is gastric symptoms. कि पेट फूल रहा है, गैस हो गया, ये हो रहा है. So the kind of gastritis जिसको हम बोलते हैं, तो उसको avoid करने के लिए we have to maintain a short, avoid fasting. Small and multiple meals would be a better idea.
And do you have patients who come up to you and say कि सर डॉक्टर डायलिसिस तो हो ही रहा है, मैं कुछ भी खा सकता हूँ? वो उस टाइप के भी पेशेंट्स होते होंगे जो एक तरफ समोसा कचौड़ी भी खा रहे हैं, सब चिकन बटर
वो डायलिसिस के टाइम में समोसा वो कचौड़ी खा लेते हैं कि वो निकल जाएगा. तो या हाँ, ऐसे भी पेशेंट्स होते हैं. और फिर हमें दिखता है कि पोटेशियम बढ़ रहा है, तो हम बताते हैं भाई थोड़ा अपना ये करो. ये डायलिसिस के टाइम में, आम के सीजन में डायलिसिस के टाइम में आम खा लेते हैं.
Because I have seen someone जो एक रसगुल्ले का डब्बा लेके जाते हैं डायलिसिस में.
नहीं, कुछ पेशेंट्स इनको शुगर्स कम हो जाते हैं डायलिसिस, तो एक उस टाइम रसगुल्ला खा लिया. तो उनका वो भी हो गया, डिजायर भी मीट हो गया और काम भी बन गया.
अभी तक डॉक्टर सबसे डेंजरस मिथ अगर किडनी के बारे में आपने सुना हो बिहार में या कहीं पे भी जहाँ पे भी आप रहे हैं अभी तक, जो आपको लगता है ये कैसे इसको मैं कैसे कन्विंस करूं कि ऐसा कुछ भी नहीं होता है?
जो सबसे डेंजरस मिथ है अबाउट किडनी डिजीज इज डेफिनेटली मूविंग टुवर्ड्स आयुर्वेदिक मेडिकेशंस. व्हाट आई हैव सीन कि once the patient, usually once they find out that they have kidney disease, obviously it must be it is emotionally very difficult for them, not only them, their family also. So everyone is desperate कि भाई कुछ करके करना है ये. And sometimes the doctors are very blunt कि भाई this is there and this is not going to go away.
Yeah.
So finding that out is mentally very traumatizing. If you Google kidney disease on YouTube, you will get so many people who are promising
they're claiming कि
yeah.
आप डायलिसिस पे जाओगे ही नहीं. अगर आप 3 साल से डायलिसिस पे हो तो I will set you free. How is that possible that they're getting away with it? ये बोल भी
I know. So I don't understand how this works and why people are getting away with it. This is my theory. There's obviously these people shouting at the top of their voices must be having some examples of people coming out of dialysis, right? Otherwise, nobody would trust them. So, there are some patients who have AKI, who have been on dialysis, whose kidney functions takes a little bit of time to recover. And if you stop dialysis for those patients, the kidney functions usually starts recovering on its own. and those might be or maybe they are mixing steroids into some of their jadi booties. I don't know how they've become credible, but I somehow feel it's criminal.
It is.
हाँ.
It is.
So
false hopes तो दे ही रहे हो.
and we have seen people like going really bad because they've been avoiding dialysis for so long that when you put them on dialysis, getting them back on their feet is very difficult. And those are the patients who set a bad precedent. I mean, who give a bad sort of bad publicity to dialysis.
Yeah.
कि जब dialysis होता है, इसका मतलब it's like end of life.
Yeah.
So I am not saying कि dialysis is something that will just make you the cure of your disease. It has its own side effects, it has its own problems, it has its own this thing. But at least if you start dialysis at the right time, things are much better than starting dialysis at a much when you're much more frail, when it's difficult to tolerate dialysis. That's the problem.
Dialysis के पहले वाला part is getting the fistula made, right?
Yeah.
So when you say the right time, when you start at the right time, what is the right time when the patient should be completely convinced कि इससे ज़्यादा एक और दिन भी मेरे को delay नहीं करना चाहिए? A lot of people don't understand how fistula also works
yeah.
and what happens when it doesn't work. ये भी होता है ना बहुत cases में कि
a lot of people don't know what dialysis is.
Exactly. तो fistula तो उनको पता ही नहीं कि पहले से बनाना होता है. तो
जो अमेरिकन गाइडलाइंस हैं या जो हमारी इंटरनेशनल गाइडलाइंस हैं, वो कहती हैं कि जब पेशेंट का CKD स्टेज 4 हो जाए ना, then you start telling the patient about making a plan. It's called CKD life plan ना, कि what kind of renal replacement therapy would the patient want to go into. So रीनल रिप्लेसमेंट थेरेपी का मतलब हुआ, किडनी रिप्लेसमेंट थेरेपी का मतलब हुआ कि भाई जब आपकी किडनी पूरी तरह ख़राब हो जाएगी या फिर जब आपका GFR अराउंड 5 to 10 इंच के बीच में रहेगा, किसी पेशेंट में लेस देन 5 रहेगा और आप डायलिसिस में आपको डाला जाएगा, या आपको किस तरह का रीनल रिप्लेसमेंट चाहिए, तो या तो आप हीमोडायलिसिस करा लो, या पेरिटोनियल डायलिसिस कराओ, या आप किडनी ट्रांसप्लांट कराओ. सो यू हैव टू स्टार्ट मेकिंग अ प्लान दैट वे. अगर आप हीमोडायलिसिस के लिए जाते हो तो हीमोडायलिसिस में आपको फिस्टुला बनवाना चाहिए, एंड दैट इज़ द स्टेज CKD 4 और 5 के बीच में when you should get a fistula made, because sometimes what happens कि fistula doesn't work. प्राइमरी फेलियर कहते हैं उसको. तो अब कभी कभी वो हो जाता है, तो दैट इज़ अ सेटबैक फॉर बोथ द डॉक्टर एंड द पेशेंट.
उसका नर्व से कोई कनेक्शन है क्या?
वेन्स एंड आर्टरी से. हाँ,
कि पतला या मोटा.
हाँ. सो व्हाट हैपेंस इज, आई विल टेल यू, कि हम लोग जो वेन यूज़ करते हैं, सिफेलिक वेन बोलते हैं उसको ना, वो यहाँ यूजली इस पार्ट ऑफ द रिस्ट से निकल के ऐसे जाती है, ऊपर तक जाती है, देन गोज इनटू द हार्ट. सो सिफेलिक वेन और हम जो आर्टरी यूज़ करते हैं, आर्टरी इज़ यूजली रेडियल आर्टरी. दिस इज़ आवर मोस्ट कॉमन प्लेस फॉर फिस्टुला. देयर आर सम फिस्टुला जो कि आप यहाँ पे रिस्ट पे भी बना सकते हो. देयर आर सम द कॉमन फिस्टुला जो आप फोरआर्म पे बना सकते हो, कुछ आप बना सकते हो या एल्बो के एरिया में बना सकते हो ना. आजकल तो लेग्स में भी फिस्टुला बनने लगे हैं ना, अब वो ऐसे बना सकते हो. तो जो हमारे ग्रुप ऑफ पेशेंट्स होते हैं, they have had a chronic illness for very long time, this is diabetes, hypertension. वो हमारे वेसल्स को अफेक्ट करता है, आर्टरी को अफेक्ट करता है, वेन को तो नहीं करता, आर्टरी को करता है. वेन किसी में पतली सी होती है. यूजली फीमेल्स हैव उनके वेन का कैलिबर थोड़ा कम होता है ना, तो उनमें थोड़ा कभी कभी मुश्किल होती है. वी हैव अ सेट प्रोटोकॉल कि इतना डायमीटर का होगा, देन इट विल बी मोर फंक्शनल. बट एवरी टाइम द इमेजिंग जो होता है वो सही भी नहीं होता. तो आर्टरी और वेन में प्रॉब्लम्स आ सकती हैं लोगों के, और हमारे जो अगर लॉन्ग स्टैंडिंग डायबिटिक्स है तो उनमें ज़्यादा प्रॉब्लम, या एल्डरली हैं तो उनमें ज़्यादा प्रॉब्लम्स आती हैं. इसीलिए हमारा प्लान होता है कि हम पहले से फिस्टुला इनको रेडी कर लें, एंड एक बार इनका फिस्टुला रेडी हो जाए, देन एटलीस्ट वी विल फील सेफ दैट वी वोंट हैव टू यूज योर नेक वेन्स ना.
That happens only in emergency cases, जब ये नहीं बन सकता
when वो नहीं बना हुआ है and the patient requires urgent dialysis, then you have to use a neck vein.
But that happens for a temporary period of time या फिर उसके बाद
If
normal?
a patient has to go into permanent dialysis, तो फिर we have to make a fistula after that. ना if the patient recovers, या किसी को बहुत बार होता है कि किसी patient को hospital में अपने admit किया, उसको acute kidney injury जिसको बोलते हैं, तो acute kidney injury में होता है कि patient को 2-3 डायलिसिस लगे, 4-5 डायलिसिस लगे, पेशेंट अपने जो भी इलनेस है उससे रिकवर करने लगा, तो उसकी किडनी भी रिकवर करने लगी एंड द पेशेंट डजंट रिक्वायर डायलिसिस एनीमोर, तो उस समय फिर वो निकाल देते हैं. जो क्रॉनिक किडनी डिजीज वाले पेशेंट होते हैं, क्रॉनिक जिनका प्रॉब्लम पुराना है और धीरे धीरे करके बढ़ा है, उनमें होता है कि हमने डायलिसिस शुरू किया इससे ना, फिर हमने बोला फिस्टुला बनाओ, जब फिस्टुला रेडी हो जाता है तो फिर हम इसको निकाल देते हैं.
आपसे कभी किसी पेशेंट ने पूछा है कि डॉक्टर आर्टिफिशियल किडनी कब आएगी?
आर्टिफिशियल, हाँ, मतलब बहुत लोग पूछते हैं, बहुत लोग बहुत दिन से पूछ रहे हैं. और आर्टिफिशियल किडनी में रिसर्च चल रहा है. आई थिंक देयर इज एन इंडियन साइंटिस्ट इन कैलिफोर्निया हु इज वर्किंग ऑन इट. It had shown promise in the last decade, but right now it doesn't look feasible, at least in the next 5 years.
Okay.
However, xenotransplantation has become the rage now.
What is that?
Xenotransplantation का मतलब होता है you getting a kidney from, because there's a lot of kidney shortage everywhere in the world. So US जैसी countries में deceased donor जो हम बोलते हैं dead donor, उनसे ज़्यादातर किडनीज ली जाती हैं, तो वो भी शॉर्टेज में है ना. कोई रोड ट्रैफिक एक्सीडेंट, मोस्ट ऑफ द टाइम्स some of the patients who are dying, their kidneys are not functioning well enough,
like
ना.
brain dead.
Brain dead जो आप बोलते हैं, हाँ. तो brain dead donors जो होते हैं, they're not in enough numbers to fill in for like जो chronic kidney disease, जो transplant का उनका लिस्ट है वो बहुत लंबा होता जा रहा है, और जो डोनर्स है उतने नहीं होते हैं.
Is this what we call cadaver?
Cadaveric donation, yes. इंडिया में तो it is like इंडिया में it is picking up in Gujarat, in the south. We the first cadaveric donor liver transplantation was done day before yesterday in AIMS. So there was it was done day before yesterday in AIMS. The kidneys, however, could not be salvaged because वो immunity का problem हो रहा था, so kidneys नहीं निकल पाई, but liver का हो गया. So we are also taking steps into doing this, and there is a list at Medanta also, a deceased donor का list बन रहा है. It goes to the state organ and tissue transplantation organization. So there is the process of starting this in Bihar also, and we are probably will do it in the next couple of years. Xenotransplantation is when you take a genetically modified pig's kidney and transplant it into a human. It was done last year. The first such transplant was done. Unfortunately, the first patient passed away because the patient had a lot of other problems as well. It's not like the patient had been on dialysis for the last 10 years, and did not have a dialysis proper access and all also, and had heart issues also. The second transplant that was done, unfortunately, after 4 months of the transplant, the transplant was successful for 4 months. But then the kidney sort of got rejected. So these steps, these are huge steps. Like initially, if you did that, the kidney would start getting rejected immediately. The kidney would turn black if you joined it. But now the genetically modified pig's kidney that was put, it sustained the patient's kidney function for at least 4 months before. So obviously some more research has to be done, and like a few more gene you call them, you nick a few genes from the pig's kidney, and you put some of the human genes into the other kidney, into the modified kidney, modified pig, and that can reduce the rate of rejection. So this is happening this could be happening in a couple of years, when things can become like that. You have a pig's kidney, genetically modified pig's kidney, and why they have chosen a pig is because a pig usually reaches uh, an adult human size at 6 months of age, right? So you have a modified pig kidney. You get a modified pig, and the pig is reared for 6 months and becomes human. The size becomes human, and the kidney size also becomes almost human-like. So you can do it very fast, right? So it is looking very probable in the near future.
But do you think जो लोग deeply religious हैं,
हाँ.
उनके लिए ये
Pig के
problematic हो सकता है?
उनके लिए प्रॉब्लमेटिक हो सकता है, स्पेशली आई नो. आई डोंट नो कि रिलीजियस पॉइंट ऑफ व्यू से कैसे उसको ये करेंगे, एंड आई डोंट, सो दैट इज व्हाई आई गिव यू द रीजन कि भाई व्हाई दे chose a pig. They tried it with many other animals also. So but the pig fit all the bills because pigs are born in multiples, right? First, pigs are born in multiples. The pigs can get to human size at only 6 months. No. So you can have multiple kidneys. And the pig kidney size is very similar to human kidney size. So at that age. So that is the reason why it was chosen, not because just to leave out some people from this.
And I think a lot of people have to rethink their food choices as well. Pork momos खाने के पहले अब शायद सोचना पड़ेगा हम किसी का लाइफ बचने से
But those pigs, नहीं. But those pigs are
not
totally
genetically modified.
Yeah.
So they उनको खा सकते हैं.
उनको खा सकते हैं.
And doctor, the other thing is कि एक जो केस हम लोग काफ़ी ज़्यादा भी देख रहे हैं, and there's an increasing number of heart attacks happening in the, especially in the young people who are going to the gym. They're very active, leading a very healthy lifestyle, but heart attacks, say they're dying. Like, it's very concerning because 10-15 साल पहले ये नहीं हो रहा था. Why is this happening?
So the incidence of heart attack in young patients is mainly to do, I think, with the food habits. So many of us, I don't know if we've gotten ourselves tested, many of us, even at a young age, have a high cholesterol level.
Yeah.
Right. And that has mainly to do with our dietary, our lifestyle choices, our food habits, whether you drink or smoke,
drinking,
yes, and all those things. So,
and then if you start going to the gym,
and if you start going to the gym, so there some of them are more predisposed than the others to form the dangerous plaques that form on the vessels of the heart. So those people who are more predisposed, who exert that, when you're going to the gym, you're actually exerting your heart to do more work. If you're exerting your heart to do more work, you're making if you're already genetically predisposed, or if you have a family history, or if you have like, there are lots of people who smoke and also go to the gym.
Yeah,
right?
They hike, they
whatever, I don't know, so many things. So if you do those things and also go to the gym, so you are making your heart work extra. And if you're not keeping those habits, I mean, if those habits are not healthy, the other habits, the eating habits are not healthy, then you're definitely at high risk of.
मतलब आप स्मोक करके बीच पे चिल कर रहे हो तो हार्ट अटैक के बारे में नहीं.
आप स्मोक करके बीच पे चिल कर रहे हो तो आपको हार्ट अटैक मेरी बेड पे आएगा, जिम में नहीं आएगा.
And what about creatine and protein powder? Because इसमें भी अब लोग ये कहते हैं कि भले आप इंटेंस वर्कआउट कर रहे हो या नहीं कर रहे हो, आपका प्रोटीन रिक्वायरमेंट पूरा करना है. एंड इफ यू आर नॉट गेटिंग इट थ्रू योर डाइट, नॉर्मल डाइट, एटलीस्ट one meal you should replace with protein powder.
So I don't believe in like adding, like replacing, supplementing your meal with a protein powder. Some people are going to the gym, if they're healthy, if they're in need of that extra bit of protein, and if their kidneys are working fine, they can go and they can take that extra bit of protein. With creatine, what happens is it breaks into creatinine, right? So creatine is the starting product and it is metabolized in the liver and in the muscles to creatine, right? So sometimes what happens is when you're taking creatine,
I've recently started taking, so I'm getting scared.
Yeah, so when you're taking creatine, what happens is you, even if your kidneys are working fine,
they will stop working.
No. Okay. It doesn't happen. Even if your kidneys are working fine, your body's creatinine load becomes higher. So if you're taking creatinine and you go and get a kidney function test done, your creatinine might be a little bit on the higher side, right?
Best thing is to avoid it.
No, it's not like that. It's not. So why it happens is because आपका creatinine का load ज़्यादा है, not because your kidneys are not working.
Okay.
So you should know कि अगर आप creatine खा रहे हो और आपका KFT बढ़ा हुआ आता है, creatine बढ़ा हुआ आता है, तो इसका मतलब कि आपका creatinine का load ज़्यादा है, not because कि kidney आपकी function नहीं कर रही है.
But over a prolonged period of time, what will happen?
I don't think कि over a prolonged period of time it is going to harm the kidneys.
Okay.
It does not harm the kidneys. Creatine does not harm kidneys, but creatine, what it does is it makes your muscles bulky. It starts, the creatine leads to excessive water absorption by the kidneys. So you might get dehydrated. That's why they tell you ना, when you take creatine you should keep drinking water.
कि 3 to 5 grams अगर आप ले रहे हो तो 750 या 1 liter
पानी के साथ लो. And पानी क्यों ले रहे हो? क्योंकि आपका जो आप एक तो जिम जा रहे हो, उसमें आप स्वेट कर रहे हो, आपने क्रिएटिन ले लिया कि भाई आपका मसल्स को, क्रिएटिन इज अ सोर्स ऑफ एनर्जी फॉर योर मसल्स. तो जब क्रिएटिन ब्रेक डाउन होता है क्रिएटिन बनता है. तो एक तो आप जिम जा रहे हो, जिम में आप डिहाइड्रेट हो गए, आपने क्रिएटिन भी लिया हुआ है, तो क्रिएटिन क्या करता है, वो मसल्स में वाटर को पुल इन कर देता है. आपके वेसल्स में, आपके जो ब्लड वेसल्स हैं उसमें पानी, जो फ्लूइड है वो कम हो जाता है ना. तो अगर आप वैसा करोगे तो आपको डिहाइड्रेशन के कारण आपको प्रॉब्लम हो जाएगी, rather than कि क्रिएटिन एज अ सब्सटेंस इटसेल्फ. वे प्रोटीन का जहाँ तक बात है कि वे प्रोटीन अगर आप हेल्दी हो, आपको हाइपरटेंशन नहीं है, आपको कोई भी आपका प्रोटीन लीकेज नहीं हो रहा, आपका किडनी फंक्शन नॉर्मल है, अगर आप ले रहे हो अप टू 1.2 1.3 grams per kg per day, sometimes even 1.5 grams, it is not going to affect your kidneys. But if somebody has a kidney problem, not everybody who goes to the gym gets their kidney checked first, right? So if you have a kidney problem, then it is going to affect your kidneys badly. Why? Because that protein, if it leaks into the tubules of the kidney, will cause damage to the cells of the kidney.
So you would say कि creatine
कि नॉर्मल लोग, हाँ ये सब लेने से पहले you have to, हाँ
kidney function test,
KFT, यूरिन रूटीन और यूरिन प्रोटीन क्रिएटिनिन रेशियो. गरीब लोगों के लिए KFT एंड यूरिन रूटीन, थोड़ा सा ज्यादा के लिए यूरिन प्रोटीन क्रिएटिनिन रेशियो.
Okay.
ठीक है, मतलब यूरिन रूटीन is like the cheapest. मेदांता में it is getting done at 35 rupees. That is the CGHS rate ना. 35 rupees में आपका यूरिन रूटीन हो जाता है. और आपका KFT अगर आप सिर्फ क्रिएटिनिन नहीं कराओ, क्रिएटिनिन सोडियम पोटेशियम, hardly takes 100 rupees. Even at like normal centers, you get that done. If everything is normal, then you can go and do your thing with. Don't like, what is whey protein? Whey protein is like just concentrated milk protein, right? So either you have whey or you have casein, right? So it's not going to be that harmful if you take a little bit extra.
Okay.
I would however recommend कि you take more of the natural sources of protein. And even if you take whey protein and don't go to the gym, that protein is going to get wasted. It's going to get out of your GIT being unutilized. So your body knows what to take and what not to take.
The cost of dialysis versus transplant. How do you help that person navigate through it? How do you explain that 5 years with dialysis is going to look like this in terms of monetary, in terms of physical, in terms of emotional? How do you explain that picture?
So we believe, I will not believe, and it's been proved through lots of studies that have been done. The first thing that you have to look into in a patient, what do you want to do with the patient? You have to improve their quality of life. Now, they should be not only living, they should be living in a more healthy way. They should be living in a more productive way.
Yeah.
So, so that they can contribute to the society. So, a transplant can improve a person's quality of life, and not only, and it has been shown that transplants definitely have, patients have a longer lifespan post transplant, and patients also have uh, a better quality of life post transplant. So for us, we would definitely say transplant is the better way of renal replacement than any, because the new kidney that you get, it's not only doing the job of filtering. Kidneys don't only filter waste
जो
products.
मोस्टली हम लोगों को यही लगता
हाँ
है
हाँ, किडनीज ऐसे हार्मोन बनाती है जो ब्लड बनाता है, इसलिए यू हैव टू टेक दोस मेडिकेशंस, जो इंजेक्शंस हम लेते हैं
Right.
ना, टू दे मेक द हार्मोन जो आपके खून बनाता है ना, विटामिन डी का मेटाबॉलिज्म,
इसलिए
आपका बोन
hemoglobin
हेल्थ।
कम हो जाता है।
हाँ, इसलिए जब किडनी खराब होती है हीमोग्लोबिन कम हो जाता है। तो दे मेक द हार्मोन, वो आपके विटामिन डी को मेटाबोलाइज करता है, तो बोन हेल्थ में होता है उसका इशू। अगर ज़्यादा एसिडिटी होगी, बोन कमजोर, इसलिए देयर आर लॉट्स ऑफ सीकेडी पेशेंट्स हु कंप्लेन ऑफ एक्स एंड पेन्स ना, सो ऑल दोस थिंग्स। So in those terms, the transplanted kidney is better than in dialysis. The outcome of dialysis is, the studies that have been done, I think in the last millennium, I think some 20-25 years back, said that there is a 60% 5-year survival, right? So 5-year survival, 60% का होना मतलब कि if 100 people start dialysis today, 60% of them will be alive, 60 of them will be alive at 5 years. So it's different for different people.
Of course.
So patients who are more morbid and they start dialysis, obviously their life expectancy is not going to be 5 years. So transplant is a better option. There are some problems with transplant also, but they can nowadays be, now we are transplanting kidneys from pigs to humans. So imagine, so our know-how of transplant has increased drastically in the last 10-15 years. And the outcomes have become better. The rejection rates have become much better. The infection rates have become much better. So transplant is definitely a much better way of kidney replacement than either hemodialysis or peritoneal dialysis.
Is there like a safest person to donate for a patient within the family?
Within the family, yes, there is a twin.
Yeah, of course.
So the first transplant that was done, it was done between two twins. The first successful transplant was done between two twins, and I think the twin who donated actually, the person who got the kidney outlived the other twin.
So अगर twin नहीं है, then in that case,
So yes, a first degree relative is a very good donor, because हमारे बॉडी में जो इम्यूनिटी वाले सेल्स होते हैं, इफ़ दे आर सिमिलर, देन आपकी बॉडी जो किडनी आपको अगर कोई आपका सिबलिंग देगा, या आपके वन ऑफ द पेरेंट्स देंगे, या वन ऑफ द चिल्ड्रन देंगे। सो अगर सिबलिंग देगा तो देयर इज द पॉसिबिलिटी कि दोनों जो इम्यूनिटी को रिकग्नाइज करने वाले प्रोटीन्स होते हैं, वो दोनों हो सकता है सारे मैच करते हो, तो रिजेक्शन के चांसेस बहुत कम हो जाते हैं। व्हाट वी कॉल इन आवर नेफ्रोलॉजी लैंग्वेज इज 6x6 मैच और 12x12 मैच, जो भी जहाँ से भी वो करा रहे हैं। तो अगर मैचिंग हो जाती है तो उसमें रिजेक्शन के चांसेस बहुत कम हो जाते हैं, इन्फेक्शन के चांसेस बहुत कम हो जाते हैं। सो दैट इज लाइक द परफेक्ट डोनर फॉर समबडी। द सेकेंड बेस्ट इज वन ऑफ द पेरेंट्स और वन ऑफ द चिल्ड्रन, बिकॉज आधे तो आपके वो वाले सेम ही होंगे ना, आधे दूसरे पेरेंट के होंगे, आधे उस पेरेंट के होंगे, इस तरह होगा। सो that is the second best. If that is not possible, then medically the advantages become lesser, but in order to prevent trafficking and in order to prevent the trade of organs, it's better that you get it from a spouse. No, a spousal donor is, I think, like the most common form of donor. No, and if
बट ये 6x6 मैच तो नहीं होता
नहीं, ये तो जीरो जीरो
Of course,
जीरो मैच
हाँ,
है, लेकिन बट वो दैट्स व्हाई आई सेड कि मेडिकल रीजंस नहीं,
हाँ.
बट फॉर लीगल रीजंस
Got
ना,
it.
या फिर कोई बाहर देशों में अल्ट्रुइस्टिक डोनर भी होते हैं कि भाई कोई
राइट yes.
सेलिना गोमेज को
Yes,
दिया
yes.
ना, सेलिना गोमेज इज अ ट्रांसप्लांट पेशेंट,
Yes.
तो उसकी फ्रेंड ने दिया, तो यू कैन इफ, बट यहाँ पे जो लॉज हैं, देयर इज अ वेरी स्ट्रिक्ट लॉ टू प्रिवेंट ऑर्गन ट्रैफिकिंग, and you have to take the permission of an authorization committee for altruistic donors. You have to be of the same socio-economic status. It's not like someone's help will they donate for no financial reasons. तो better होता है कि तो उसमें उस केस में then you have to go to the authorization committee, सब में जाते हैं, but the altruistic donor is the one which is scrutinized the most, and we tend to discourage that. We would prefer कि कोई family वाला खुद close family member, like people who live in the same house, if they donate, then that's fine.
And Dr. Peritoneal dialysis, okay, now I want to understand from you is जितना मेरी understanding है that it can be easily done at home.
Yeah.
ठीक है. Why do you think ये फिर भी जो रूरल पार्ट है हमारी कंट्री का, वहाँ इतना अभी भी ये वायबल फीजिबल उनके लिए क्यों नहीं हो पा रहा है? What do you think is the...
So there is an example of the state of Assam, where, so I think we had a East Zone conference here. The nephrologist, the associate professor of Guwahati Medical College was there. I think she is the associate professor. So she was there, and she in her talk mentioned that a lot of her patients were undergoing peritoneal dialysis. So the primary reason why it was so popular there is because the government was providing the peritoneal fluids for free to patients. So patients who come from a rural area and find it very difficult to travel long distances for dialysis, it is a boon for them.
Yeah.
The problem being that it is almost as costly as hemodialysis. If you look into the expenditure on the fluid, the gloves, the disposables, the kind of environment you have to be in, all those things. So if you negate the cost out of peritoneal dialysis, it is not a bad option actually. And the reason why it has not gained popularity in Bihar at all is because of the same reason. One being that it is costly, almost as costly as
The regular
dialysis, hemodialysis. Second being that you have to do it on your own, or somebody has to learn, and you have to do it every day.
Ultra careful, cautious.
You have to be a little bit careful, and so it has to be done in a well ventilated room. Possibly should be air conditioned, and it has to be done in a particular way where you. And third thing, that it has to be done by people who are functionally able to do it. Otherwise, it has to be done by a caregiver. So those things, plus sort of, I think maybe some financial gains for the corporate or for whatever company is providing dialysis, that also maybe has a role why nephrologists don't really advocate for peritoneal dialysis. That is there. So so both ways, things, the patient also thinks, oh, I have to do it every day. I have to do it at home, or somebody has to do it for me. It's going to be either as costly or a little bit costlier. There are chances of infection and all those things. So why not just do normal hemodialysis? If the government looked into providing dialysis fluid, peritoneal dialysis fluid for free, maybe we could offer it to more patients.
When your daughter turns 5, how will you explain CKD to her? And if she's curious about what you do,
So, how I will explain CKD to her?
or maybe just about your work. What do you do?
Yes. So, yeah, obviously at some point in time I will have to explain. Maybe I'll leave the explaining to her mother because she would explain it in a better way. So, I mean, at 5 or maybe even at 25, I was not able to get the full grasp of CKD. It is not. It takes time, and even nephrology. I mean, even doctors sometimes get confused between a nephrologist and a urologist. So I'll give her time.
Yes, definitely.
I'll give her time. For I don't want to impose my profession onto her.
I love that. I love that.
So I want her to take her own path. I mean, if she wants to become a doctor, why not? But if she wants to do something else, then we should be able to let her go free.
One bit that you absolutely love about your job.
The bit about helping people.
And what you hate, absolutely hate.
The fact that no matter what you do, there are going to be bad experiences, and no matter how much you try to help somebody, you're not going to succeed every time.
Any worst of the worst cases, one case that you had to really struggle with and it was a very heartbreaking kind of an experience for you?
Sometimes when you feel that you could actually help a patient and save a patient, but the family is already given up. So that's when you totally feel helpless. You try to convince the family, but they say, no, we don't want any of the pain. Sometimes they're right, and you are not in their position because you are thinking in a different frame of mind. They are in a different frame of mind. Sometimes, obviously, this disease is such that sometimes there are multiple hospitalizations. Sometimes there is so much financial strain that you totally give up. So yeah, I face these kind of situations sometimes. The fact that you are limited by the patient's finances is sometimes a little sad. That's when the reality hits you that having a good amount of money is important.
How important it is, yeah. Actually, the most important thing I would say. रोना आप afford नहीं कर सकते हो. When somebody in your family is going through something like this, I think you just need money. Everything else is. Do you smoke by any chance?
It is the worst kind of habit that you can have. I mean, and it is the most addictive thing.
Yeah.
So even if somebody is smoking, I would recommend quit straight away. If you can, if you can't, take help. If you can't on your own.
And you personally have never.
No, I have, obviously. Okay. I mean, it's there's no never anything. And the occasional drinking also, not in Bihar.
Yeah. Thank you so much, doctor.
Thank you.
It's been wonderful listening to you today.